in the forward flexion with the elbow extension. If he's not able to perform actively, or ask him to clasp hands together in this way. If he's not able to perform the forward flexion with the elbow extension, is your kid?
Yes.
Really? Oh. She's gonna be. What's the problem? Yeah. Oh. Alright. If he's not able to perform this movement, we ask the patient to clasp the hand, to raise the hand together. Then I ask him to place the sound one alongside the side of the trunk. Now facing the side of the body. Now I ask him, I want to activate the extensor muscle, especially serratus anterior. Alright, to prevent the bending of the scapula and to promote the extensor activities with reaching forward. In this way, I didn't raise the upper extremity. I asked him to cross the hand, to raise the hand for safety. Most of the damages and injuries of the shoulder is from improper handling, especially the pulling of the upper extremity and damaging the shoulder. That's why, for safety, I'm asking to clasp the hand to raise the upper extremity towards and into forward flexion, to release the hand, to place it to the side of the body. Now, I ask him why keeping the wrist joint in extension with the fingers in extension and shoulder and the thumb in abduction. While supporting the back of the elbow joint, I ask him to push against my hand and I resist the movement. In this way, again. In this way, I activated the extensor pattern with shoulder and forward flexion. And I repeated in scapula. Alright, again, push against my hand, I give resistance, and then I ask him to release, to repeat, pushing against my hand. Again, and then in abduction, I repeat the technique. Release, again, relax, again, relax. In this way, the forward flexion towards the scapula, towards the abduction. In this way, the extensors are activated in different situations with different muscle groups activated. After performing this, again, I ask him to bend and extend the elbow. Relax. Again. In this way, while I am performing an exercise with the patient, I'm asking you to follow the movement. At the same time, I assess the flexor tonus as well as I assess the postural reflex mechanism. Alright? This is normal for a normal neurological person. Alright, is following the movement, is following what I'm doing with the movement with the affected upper extremity. But in patient, this indicates that the tonus of the muscles is normal and the postural reflex mechanism is being active while moving the upper since the movement is in the direction of the spastic flexors, you feel there is a help with the movement, and suddenly it will go into the flexion. But when extending the elbow due to the resistance offered by the spastic flexors, you feel resistance and difficulty in extending the elbow. And depending on the severity of the spasticity, the real resistance will be different, from minor resistance to severe resistance. Therefore, while performing this one, you feel assistance into the flexion, but you resist. What with extension, you feel resistance depending on the severity of the spasticity. This indicates that the postural tonus of the flexors is not normal. Two, the postural reflex mechanism is not working and is abnormal. But we need to repeat this technique to improve the postural reflex activity. Alright, and to normalize the spasticity. Therefore, we perform this activity in different situations and in abduction. But as I said, in patients with hemiplegia, you will experience assistance into flexion, but resistance into extension like this. Alright? But we need to repeat resistance, higher resistance. Right? As you see, into extension there is resistance due to the spasticity of the flexors. Like this one, again assistance into flexion and resistance into extension. This indicates that there is a problem with muscle tonus and postural reflex activity. I asked the patient to raise the affected upper extremity actively to try to touch the opposite shoulder, like this one. And again back to the start position, again, while it's on your lap, again, to repeat. In this way, you actively ask the patient to turn. Alright, and now with the sound side. And now an important exercise is that to ask the patient to touch the top of the head. Yeah. And to bend the elbow joint to touch the shoulder joint, like this one, to bring it close upward to the affected shoulder joint. Now I ask him to clasp the hands, to move the body forward, to displace the center of gravity, to challenge the balance of the patient. Place your foot on the ground. I ask him not this one, just lean forward like this one, alright? And back again. In this way, I challenge the balance of the patient. While looking at the point on the wall, but again, the people with this stroke do not like this movement because you challenge the balance of the patients. In this way, while he's performing that, they are reluctant to perform it. In this way, supporting the distal key point of wrist joint and shoulder, we help and we try to challenge the balance of the patients following this movement. It's ideal that the patients themselves to perform this activity. dramatically to disturb or perturb the balance of the patients, like this one, to the sun side, to the left side. I ask them to keep their body balance, like this one, to the sun on the left side, and they will rigid the body to control their balance. To the backward, downward, and performing parachute reaction like that. I pretend to throwing the propeller toward the face, alright?
And I think this change the balance or something like that. Call it writing balance test or something like that.
What's your question?
There is a test for balance which is named as a writing balance test or something like that.
Right and balance.
Right.
We have several tests to assess the balance. Best balance test, mini balance test, best test, mini best test, alright, Berg balance test, and there are various standard tests to evaluate the balance. We usually use them for research, alright, but if you want to assess the patients using the standard test, you can use the best test, mini best test, and the shortest test of the best test for use in the stroke. Berg balance test can be used also. There are various dynamic tests. For example, time up and go test can be used to test the walking and balance. 3 meters, we ask the patient to walk 3 meters. For example, here, after standing up from a chair, alright, we ask the patient, we use a chronometer to record the time taken to perform this test. After 3 meters walking, turning as fast as possible, the patients are required to sit back again and we record the time taken to perform this test. There are various tests, but here we just use these perturbations for challenging the balance to improve the balance reactions in people with a stroke. But we can use standard tests, especially when using it for the research. Or you may produce a standard assessment sheet. Using such standard sheets, you can apply standard tests of balance also. But best test, mini best test, and short test version of the best test can be used for stroke patients, also for other neurological conditions such as Parkinson condition. We produce the Farsi version of the best test, mini best test, and the shortest version of the best test, and you can find the various version English. I don't know, there is an Arabic version of the best test, but we validated it into Farsi, and you can find it on the website of the professor, is the developer of the best test. That's a good test, valid and reliable test for testing the balance in such patients. All right. In this way, we challenge the balance of the patient with perturbating the posture of the patient. But dynamically, we are required to challenge the balance of the patient. I ask the patient to reach with the affected one and to touch this one. Now here, 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 again here, backward, now here, now towards the affected side again, here, now here, here. In this way, dynamically, we challenge the balance of the patients, because most of the time in daily routines, they need, while keeping the body balance, to perform various functions, to perform ADL or to perform their social roles while in the society. Therefore, dynamically, you are required to challenge the balance of the patients in sitting position, even in supine, standing and walking position and posture. All right. While the legs are resting on the floor, all right, I push about the knee towards the ground in this way to improve the proprioception of the knee joint before asking to perform the active knee flexion like this one. Again, I use my weight to compress it heavily from the about of the knee joint like this one. Now I ask him, avoiding raising the elbow, raising the knee joint, to slowly bend the knee joint on the affected side while keeping the foot on the ground, all right? And we must adjust to bring it down, all right? You be in a 90-90 position to perform this movement, all right? There is a chair here. All right. Playing with the mobile. Sit on the chair. Here I'll show you with the body in 90-90 posture. I ask you to bend the knee joint, to move it under the chair. Again, over. Another movement exercise is raising the affected leg to place it on the sound knee, like this one, without moving the trunk. The trunk must be stable in the midline position, without moving the trunk towards the affected side and bring it placement to perform this one. Compensator, they may use the trunk to perform this way. We must ask the patient to keep the trunk stable